My name is Thembi Arries. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative. Welcome to Kabecha. We are back again with another episode, which I'm sure you will find quite interesting. The topic that we're covering today is cystic fibrosis. Make sure you don't go away because we're going to be unpacking it in ways that are going to be giving quite a lot of enlightenment on respiratory problems that are triggered by it and other conditions that are triggered by it. Welcome to the show.
Hi viewers, thank you for tuning in. We are back again this week with another exciting topic. I'm back with the questions and Thembi is here to answer my questions. Thank you.
Cystic fibrosis, some of you may be aware or may have heard about it or maybe know of someone who's got cystic fibrosis. But most of the time, people that are known to be having it are people that have got respiratory problems because it causes a lot of respiratory problems. But there are other systems that get affected because of that. There are people who cannot conceive because of cystic fibrosis. There are people who have got serious digestive problems because of cystic fibrosis. But as we discuss down the line, I'm going to be touching more on how those other organs or other systems are affected. But as usual, I've prepared this clip for you. Please take a look.
There are people who cannot conceive. There are people who are seriously malnourished. There are people with serious respiratory problems. The list is endless. The common cause is cystic fibrosis. Every part of the body is made up of cells which carry out a number of functions for your body. One of those functions is to maintain fluid balance throughout the body. Every cell must be hydrated both inside and outside. The water and salt provide this function under the regulation or management of genetically provided protein. When this protein is absent because of a genetic default, this affects this process and causes dehydration to the exterior of the cell. This causes fluids and mucus to thicken and block the ducts and airways that transport these fluids.
Welcome back. As usual, as Lorica has already indicated, we're going to be discussing around the questions. And I really encourage you to continue sending these questions because they guide us. We may not know what kind of questions you have or what kind of information you need. We may just be covering the topic. But when you send these questions, they help us to kind of map out the direction of the questions or the information that you're looking for. All right, let's dive into it.
Okay, thank you, Thembi. In the previous episode, we covered respiratory illnesses and different uncommon types. This is another uncommon one. How difficult is it to confuse it with a severe form of asthma?
Yeah. It happens a lot. Like I indicated in the previous episode, that there are people who've got respiratory problems, but which have got nothing to do with asthma, but who know themselves to be having asthma because that's the label or the diagnosis they've been given. it's the same with cystic fibrosis, that there are many people who are sitting with cystic fibrosis. And as we go down in the show, I'm going to be giving examples of that. People who sit with cystic fibrosis, because it causes a lot of respiratory breathlessness. You know, it causes serious shortness of breath. And therefore, you find people are on chronic medication, whether it's prednisone, anti-inflammatories, or they are on pump, so there is quite a few of such issues. And like I've said in the previous shows, that the problem that leads to that is that the departure point of conventional medicine is symptoms. So when you get to his surgery, his rooms, and you cannot breathe, of course, the immediate treatment that you're supposed to get is something that's going to dilate your bronchial tubes or your lungs so that you can at least be able to get the oxygen in. But beyond that, because once you get that and the breathing is much better, then you find you're sent home to a great extent. Or in most cases, you are given, they do some x-rays, they do some blood work and what have you. But cystic fibrosis is very likely not to be detected in your respirators, in your x-ray, for instance, because it's a gene mutation problem. So you find it is your genetics that will be able to detect it. But it's easier to detect it in cases of children. Because when it's children who are suffering from severe breathlessness, then you find, then they start investigating further than just giving medication for asthmatic treatment. So that's how you find it's a bit easier to detect it among the children than it is with adults. Because with adults, when you cannot breathe, assumption is, asthma. And here's something that's going to help get you oxygen in, and then you go home, then you get another attack, and they change the medication. So it's difficult to find situations where at the top of your, at your first entry, then they check for cystic fibrosis. I don't know if it would be over expectation on my side to think that in your first visit, that's what's supposed to happen. But that is what is supposed to happen. The fact that the setup of conventional medicine is such that it moves from the symptom is actually setting them up for failure. That is why you find I always go back to that. Because if you walk in and they detect from the onset you've got cystic fibrosis, then the treatment is going to follow that direction, as opposed to drumming on asthma, which you don't have, or just giving you things that are just going to make you at least breathe. So I'm not over expecting when I say first visit. They must know, because that's the whole idea of going to your practitioner. Your first visit is, I'm sitting with this problem. What is it? You need to know what is it, then you're going to know which direction you must follow. Because when it's cystic fibrosis, you need to take a different direction. Because as the clip shows, cystic fibrosis is not just it's not a respiratory problem. It's a mucus, it's a fluid management or regulating condition. So if the body fails to do that, because it's not the doctor's function to do that, it is the gene. It is a certain type of protein that is produced by that gene which does that function. So when you don't have that, then you are exposed to it. So, but how to help you will be determined by the discovery of this or the detection of this particular condition. So it is difficult to detect it because of how the treatment processes or the treatment programs of conventional medicine have been set up. And I'm not blaming doctors. I'm taking it back to their training, to the curriculum, because that's how you execute what you have been taught. You don't come up with your own thing. So if you've been taught that, okay, if this person cannot breathe, this is the medication you can give, the pump, this, you depart from there. That's how you've been trained. So it's unfair to expect them to do anything different from what they've been taught. So that's why we're sitting with serious issues of cystic fibrosis, particularly now during winter, like I was saying, that most people with respiratory problems, they die in winter. They die, and that includes people with cystic fibrosis. Okay.
Okay, thank you. In my view, it sounds like quite difficult to treat this type of condition. Is that a fair assumption?
Yeah, it is difficult. And it is difficult even in a situation where you detect that and you manage to nail it, that this is cystic fibrosis. Because you must remember, firstly, the reason why you're having it, it's because you're lacking this protein. So it's a genetic defect. And that cannot be fixed. That gene that's mutating and making you short of that protein, it cannot be produced somewhere. There is no supplement that you can get somewhere that is going to provide that protein. So when, therefore, you are short supplied in your makeup, in your formation, within your mother's womb, it's a problem. So those conditions that you find are attributed to genetic defects, gene mutations, those type of things, they are difficult to fix. You can just manage them because you can't provide supplementary kind of protein to do the function. I don't know with AI, with Elon, because they're like trying to make a human being. So I don't know if those type of things, if you're short of that particular protein, if their robots will be able to create that protein and then do that kind of thing. I don't know. That's just to digress a bit. So that's the first reason why it's difficult to treat, because you cannot replace that protein and you cannot provide a supplement for it. You don't have it, you don't have it. So now, when you don't have it, therefore, because remember, that protein regulates the fluid flow within and outside the cell. And that fluid has got to move like that. Remember, we are more water, we are more fluid than solid, than flesh, and we carry a lot of fluids in our bodies. So, and that has to be regulated. That has got to be balanced. And it is such a complicated process. It involves so many systems and so many processes to be able to regulate that. But it also involves the divine providence, because these things are divinely provided at your conception. That God starts engineering, doing his own things. So when he has not given you that protein, for whatever reason that he knows, then that's going to be your cross. So that's number one. But now, as number two, I've said that because the function of this protein is to regulate the fluid flow within the cells, that you must have so much fluid, and then and that fluid is also not just fluid, it carries salt. It carries salt. So to retain water within, like for instance, I've said that people that have got issues of kidney problems where the adrenal glands are affected, because that adrenal gland produces certain hormones, and one of those is aldosterone, which maintains fluid, helps with the retention of fluid within the cells, So when, therefore, you are having issues of the regulator of the protein that's supposed to manage that process, and therefore you're going to sit with fluid that is misplaced haphazardly, and that creates problems. So that means, therefore, when you're treating, because remember, the fluid within the cell, when you've got cystic fibrosis, the fluid within the cell, that protein is not managing to attract it and pull it out to the outside the cell. It remains in the cell, and therefore the outside of the cell, where all these fluids that are controlling, that are channeling to the airways, to your pancreas, to your genitals, to your those fluids are supposed to be free-flowing. But that fluid that you're not managing to attract, to drain out of the cell, it's stuck there. Then these that are outside, they're dry. That's why the fluid, it thickens, because it's dehydrated. So when that is, so you need, therefore, when you're treating, to first know how to smoke out the fluid that is stuck within the cells. And then you know how to hydrate, because even with the hydration, you need to know how to hydrate these that are not receiving. So you need to do that continuous balancing, fluid balance. While you're doing that, you need to sort out the damage, because if cystic fibrosis is affecting the lungs, that person cannot breathe properly. And when you cannot breathe properly, you are so exposed to all these pathogens that are attacking your respiratory system, because remember, we're sitting with a whole lot of them that are taking there. So because it's moist, it's warm, it's dark, they thrive there. So then you end up becoming so much exposed to inflammation. So that's why you find these people are sitting on these steroids for keeps, because it's just to kind of manage inflammation as well. So you need to deal with that, because inflammation also is a problem. So you have to work. Now, if it's affecting the reproductive system, the person is not conceiving, because the sperms get stuck there. They cannot flow, because the fluid must be porous. You must be able, the sperm must be able to flow and even the female, if it's the female who's got cystic fibrosis, even if they're flowing from the man, but they're not managing to flow through to the egg because the mucus is too thick. So depending on who is affected, which is one of the things where I say, when people say, we are not having children, and it's always the assumption, it's the woman. It's the woman. No. That is why I always say, both partners must come. Because you may find it's not this poor woman who's always, they are swearing at her and scannering behind her, that she's not, whatever, the mamazala, and everyone is, meanwhile, it's their son who cannot conceive, who cannot produce sperms that flow through because it's stuck in the cystic fibrosis. These things I deal with. Actually, I had a couple from Matatiele, interestingly enough, who had an infertility problem. So they were bringing the wife because she had tried so many times to conceive, but she's not conceiving at all. So I said, no, because we're already here, jump into the scan as well, so that we can see what's the wara. And it was the husband who had cystic fibrosis. Those sperms were stuck there. So, and we treated, but anyway, I treated both of them. And the interesting thing about this particular couple is that I said, I advised that because the wife also had her own issues, not just the case of infertility. So I advised them that for a certain period, they must abstain from intimacy. while I'm working on it. And I think they did maybe for a few days, I don't know, but I know that they didn't. And the next thing, she has conceived. They jumped the gun. So, but now the excitement, they couldn't hide that. I know we only did for a while, but we couldn't. And then voila, you see God's providence. So that's what I'm saying. Therefore, that it's not easy to treat, because you must remember this is a gene that's missing. So, and the balancing, fluid balancing, is something that's constantly happening. So now when you're sitting with this, even while we're clearing the accumulation of fluid inside the cells and hydrating the ones outside, managing that process, it doesn't mean the unavailability of that protein is going to stop causing the problem. While you're fixing here, the part which is that protein that's supposed to be managed, it's not there. So you're doing the part of cleaning, but you're also doing the part of trying to regulate. You are removing the accumulation, you're hydrating this, but then you're also trying to get the flow, to start the flow and do the work that's supposed to be done by this protein. So it's not an easy one, but I have done it. Just like I'm coaching this couple. But I've done it because I know what it is. My scan will tell me, you've got cystic fibrosis, and this is the system, these are the organs that are affected. Then I know, and this is how it has affected these particular organs. Then I know how to, tweak, and But otherwise, it's not an easy one to deal with. But I've treated it and I've nailed, like I'm giving this example of this couple from.
Can you give us an example of someone you have that you treated with this condition, and how you went about it?
Okay. In fact, this couple I've just touched. Maybe I can come up with another example. I had an Indian lady from KwaZulu-Natal. She came to see me here in Port Elizabeth, and she had not heard about me, but she had seen me on television. Nobody had referred her to me. So, but she never knew she had cystic fibrosis. She was just, she came as a chronic asthmatic person. She was on chronic medication for that, on steroids, and she said she was tired because she gets these episodes now and then, in spite of sitting with all that medication. So I scan her and I see she's got cystic fibrosis. I explained to her what it was. She was kind of, I don't want to say she was kind of disappointed with her pulmonologist. Yeah, she was really disappointed. Because she says, I've been with this person for how long? And I don't know if, but I made her understand that it's not an easy condition to get rid of. You can't totally get rid of cystic fibrosis. You can just manage to make sure that all those symptoms are kept at bay. Even the shortness of breath, you can keep it at bay. But because you know where you're coming from, the hydration, you can manage your hydration levels. You can dehydrate there, you can hydrate. So, and the whole program that I placed her on. And now the part where I was asking, when I asked her if she sometimes finds when she's because she said she belonged to the gym. And then I asked her, do you find that if accidentally you touch a sweat, there's a sweat that touch your lip, you feel it's very salty? She said no, she has never experienced that. But what she has experienced is when she's clearing the throat, the mucus that comes from that. She says it's so salty. She just feels so much salt. And she said, I've been asking my pulmonologist for keeps because I knew something is amiss. Because she said it's not just it's salty. And I'm like, where is this salt coming from? Because it's not like I've eaten anything or whatever. So she was like, that is why I'm saying she was, those things, she was disappointed, seriously disappointed that, wow. So this is what I've been suffering from all these years that I'm taking this medication. I'm sitting with a condition like this. So that explanation also of the saltiness of the slime in the throat was like another, blow, not a blow, but an emphasis to confirm my diagnosis. But with her, it did, even though the kidneys were starting to be affected, but she had been told that the kidneys were affected. But the reason she was told were affected, they told her that it was because of the steroids. Because the steroids are heavy on the kidneys, like those prednisones and whatever. So she was told it was because of that. So she was aware that the kidneys were affected, but she was told it's because of the steroids. So she just have to live with that. But they were giving her things, just to manage the kidneys as well. But I told them the steroids may have added, but the main culprit is the cystic fibrosis. But I will explain more when we come out of the break. Let's go for a break. When we come back, I will explain more how cystic fibrosis affects the kidneys.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adenylase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat?
Welcome back. We are talking about cystic fibrosis, a condition that seriously affects the respiratory system, but which in most cases is very misdiagnosed or even underdiagnosed. So when we went for a break, I was talking about this lady, this Indian lady that I diagnosed with cystic fibrosis. With her, like I said before we went for a break, she was aware that there were kidney problems, but that was because of the steroids. But when I was explaining to her how cystic fibrosis actually affects the kidneys. Now you must remember the kidneys, they are a system that manages the fluid balance. All this fluid that we get from whatever, from food, from tendon, from lymphatic system, the blood, the what have you, different types of sources of fluids and, from tissues, from what. But the elimination, the clearing of that fluid, because it must be purified, it's the kidneys that do the purification. It's the kidneys that eliminate those excess fluids through the urine and all that. But now, when you've got, therefore, a problem of cystic fibrosis, where you find that the regulation of fluid within the cells, because remember, everything starts from the cells. Everything, even that kidney has got cells which, end up making tissues and whatever, and then the organs. But everything starts from the cell. So everything, the food, those cells must be fed. They must be hydrated. They must, everything, receive everything that they need. But all that process is regulated. So now when water or when fluids, in fact, like when water with salt, because remember, where there's salt, there's water. You will find that if, for instance, a person has had too much to eat, salty stuff, they want water. They become thirsty. You've had your braai, you want to drink, because the salt, the water follows sodium. So sodium chloride, that's salt. So when therefore that problem, that process is not managed well, and you're sitting with a fluid that's not drained from the cells, and therefore the cells outside, they are so dehydrated. That is messing up what is called the electrolytes balance. Now you must remember, electrolytes balance involves it's not just only sodium chloride. It involves your potassium. It involves your magnesium, your calcium, all these minerals that you find that in most cases I talk about. And that's the electrolytes. And it's the kidneys that are managing that process. But the kidneys are at a higher or at a lower level. The starting level is at a cellular level. So that process must occur at a cellular level. And so even though not all these electrolytes are found in the same systems, but that sodium, that chloride, that is within the cells, that water, and all that is the function of the cells because of that protein. But now when that is not happening, where it ends up, because remember, all roads, those fluids and whatever, they all lead to the renal system. All roads lead to your kidneys. They must filter, they must eliminate. So when therefore that is the process that should be occurring and is not occurring, it's affecting them dearly. It's really affecting them very badly, particularly when it comes to potassium-sodium balance. Because potassium is one of the electrolytes, but potassium within the cells must always be must always be higher than the sodium. Sodium must be on the low. But now when you're retaining, you end up sitting with quite a lot of sodium. And that creates problems. Then you find potassium ends up becoming less, and then you find it's like, for instance, when people are exercising, they gym, they sweat a lot. The sweat comes with salt. Because like I'm saying, where water's going, it follows the salt. So when you're sweating, you're eliminating sodium. But now when you've got an imbalance of that, then you find you end up with cramps. That's why you find people when they go to the exercise, especially when they go for the first time, where they shock the body. It had not established its own balance yet. So now you go, and those muscles were not ready to do all that processing at the same. Then you find tomorrow you can't even walk, with the cramps are crazy because you've disturbed that balance. You did not give it a chance. You did not give a chance for that body to stabilize and equip itself with the work that is provided at hand. So the kidneys, therefore, because like I'm saying, all roads of that sodium, of the water and salt and what have you, even though the skin is also used as one of the elimination, organs, but the renal system, that's the main system that handles the elimination of that. So when, therefore, it is badly imbalanced, that is what affects the kidneys. It's not just the steroids. And you'll find that most people or some people that you find are dialyzing, are not dialyzing because they cannot urinate. They're urinating. This is one thing that one lady said, she was shocked because she's urinating normally, like every other person. And she had gone to see the doctor. I can't remember what it was for. And then she was told she must go for dialysis. And she's like, are you kidding me? And they said, and just when she came to me, she was on dialysis. And she says, I urinate like every other person. But they told me that the electrolytes were totally out. So when those electrolytes are out, totally out, then you need to assist those kidneys to try and balance those electrolytes. So the kidneys, therefore, when you've got cystic fibrosis, are really and seriously exposed. Really and seriously exposed. But the other organs, besides the reproductive system, that you find are affected will be your digestive system, will be your pancreas. And in some, I had another case, but this one was the pancreas, and it was a baby. The mother called me, and she told me that, of course, she had not seen me before, and the baby was just a few days old. Few days. Yeah, the baby was a few days old, but the doctors were battling. What were they battling? Oh, with the respiratory system. They were battling. But she said, that's when she discovered, but when she eventually ended up contacting me, a few months down the line, she said that baby was not thriving, was not picking up weight. The appetite was not, no matter how hard you try, she was still breastfeeding. And she said that child was as tiny as you can think. And the doctors were doing some tests it was in Namtata, Nelson Mandela University. They were doing some tests, and because they cannot understand they had not detected cystic fibrosis, they were still checking and checking and checking and checking. So then she contacts me, and she was describing me what was happening, the child struggling to breathe, but then the concern was more the weight, And I say, just listening to you, I can tell that child, your baby has got cystic fibrosis, because cystic fibrosis blocks the ducts. Remember, when you eat food, the digestive enzymes come from the pancreas and also from they come from the liver, from the pancreas, from the stomach. There's a whole bunch of them. But the ones that digest, your lipase enzyme comes from your pancreas, your amylase, your amino, so those that are processing the digestion of fat and proteins, and they come from the pancreas. So now when the ducts are blocked, because the pancreas, your exocrine side of the pancreas is going to release those. But when the ducts are blocked, because the mucus is so thick, then you're not receiving. Then you're not going to be able to process the digestion, and you're not going to absorb. Then you're not going to gain weight. So that's what I was telling you, that just listening from you, even though they've not given the diagnosis, just tell your doctors they must test for cystic fibrosis. That's going to be easier to get to the problem than, So I never heard from her after that, because she was not my client. I was just giving her an advice. So I'm assuming that she came right. So that's what happens. You'll find that there are those people that whatever they're eating, it may not hit the most your respiratory system, even though that is largely the region where it really lambasts you. But you may be sitting with, you don't know, you eat like you can eat the whole lamb, but you won't see fat. You won't pick up weight and all that. So those people that you find they eat, but they're not picking up weight, it may very well be one of those things that make them not to absorb. So that's those are the examples that I can.
Can you give us any other scenarios that you had in your field so far?
I'm trying to think. In fact, one area that I would like to share more is because, I mean, maybe a person is racking the brain as to they sit with, because you'll find those people that sit with a lot of phlegm. And it doesn't mean, this is one thing that I always want to stress, that when I say you sit with a lot of phlegm, it doesn't mean it's always cystic fibrosis. But it may very well be cystic fibrosis. Okay. So people that are sitting with serious respiratory problems, I really would encourage them to come to have checked, so that you're not just sitting with chronic asthmatic medication. Meanwhile, you could be taken off that medication. But the other thing that I would share is, for instance, in cases of this Indian lady that I was talking about, I did advise her. She was already doing the gym, okay, and the gym, she said it was not a struggle. Okay, so people that have got respiratory problems, it's always a good thing to exercise, but it's also a risk to exercise. You need to know, in your case, if you can handle it, okay, which is where I come in, when, especially because I will be knowing that, oh, in your case it's cystic fibrosis, then I know how to loosen that mucus, and I know how to help with the hydration. There was even a product that I once, my supplier produced after we sat and discussed, but it was not just only for cystic fibrosis, but we're just talking about electrolytes balance, people with kidney problems. So he came up with it was in powder, he's not producing it anymore. He came up with that product, which was, what was fascinating about that product was that it was taking care of all the electrolytes. It was not just only focusing on sodium. It was magnesium, it was calcium, it was potassium, it was taking care of all of them. But the nice thing about it, I don't know how he got that right. Because what was fascinating about it is that if you've got an elevated sodium, and your potassium is on the low, it's going to balance that, it's going to reverse. If it's the magnesium that is short, it for some reason, he managed to fix what was low, it would elevate. What was high, it would drop to the normal levels. I don't know, I must actually check if he cannot produce that, because the reason why he stopped was that there was not, people were not buying it that, I mean, remember, I'm the one who came up with the concept, with the idea of how do we balance these electrolytes? And he came up with this product, and it was a 1 liter container. But remember, he's not only supplying me, he supplies other health shops. Me, I'm not a health shop, I'm a clinic, but all other people, shops that are carrying his products, they are health shops. So they did not understand the dynamics of electrolytes balance. So to them, it was neither here nor there. So they did not know the value of that product. And therefore it was not selling that much, because even with me, I can take so many at a time. I won't take a whole stack and keep them in the storeroom. I don't have that capacity. So he ended up stopping, because he said the scales were not balanced financially. Were not balanced. But it was a phenomenal product. It was absolutely phenomenal, particularly for people that have got issues of dehydration, which is the case with cystic fibrosis, that the ducts outside, because the fluid is kept inside the cell, so the ducts are outside are not receiving enough fluid, so they are dehydrated, and therefore they thicken. They make the mucus, which therefore blocks the duct. So this product was doing that work, dissolving the stickiness of the mucus. But maybe I can check. I must actually check if he could not, if he can't reconsider producing it. But in any case, I also understand that at the end of the day, it must make a business sense for him to produce. So that's the scenario. But also when I treat the thing, because this is the other thing that was the case with one particular person, but in this person, it was still the reproductive system, but it was a lady, but it was not conception that she was looking at, but she was just having this discharge, so, and which was bothering her. And then, and in fact, it made her not to want to have a relationship, because she said she was forever oozing, So, and then I realized, I told her it's not the infection, it's not anything that's got to do with sexually transmitted diseases, it's cystic fibrosis, So, and then I treated her, but with her, she said, what happens was that the oozing actually became worse first, and she became concerned because she wanted it to stop. She came to me not knowing that it had to do with cystic fibrosis, but it was one of the things that was bothering her. So she wanted it to stop. And here I give her the treatment, it gets worse, And she said it got so bad that that whenever she was cleaning, the mucus would become kind of stretchy, it would be stretchy. But then I was saying, because if you remember, I said you must just have a picture of glue. I said, just imagine glue that was free-flowing. When it's free-flowing, you can put on your whatever shoe and, But when it dries up, it's sticky, but it's not flowing. I said, just imagine something like that. So with you're oozing a little bit, but now because then it means it has not thickened enough to get to that level. So I said, the fact that you find that it's happening so much is because I'm loosening the glue. So the glue is now coming out. So that's why you find it's getting worse, because you were sitting with all this glue that has thickened, but which is still oozing a little bit. Now we want it to stop. I'm dissolving everything so that it gets out, So, but at least you understood, and then eventually that discharge, it stopped. It's a complicated condition, Lorica. Like I say, it's not easy to treat. It's easy to detect for me, but even for me, it's not easy to treat. But one thing that makes it also not to be that easy to treat, it's because it's expensive. Because remember, when you've got cystic fibrosis, depending on which organs are affected, which systems are affected, I must dissolve, I must sort out the retention within the cell, I must hydrate outside. Then I must sort the damage that's already done, and so that that particular organ that is affected can do its work. But that's all money. That is all money. So when I'm giving you this and I'm giving you that and I'm giving you something like, hey, and I must give you also a bite size, financial bite size, so that you can be able to, because if I'm going to do all this and then you find it's going to be 50,000. I mean, am I dreaming? Are you? So I've got to give you the bite size. But the bite size is taking care of the immediate. This is still to be attended to. So, and when you come back and say, I feel better, but then I say, now we must come to, then it's like, oh, I must pay another money. I must pay another money. I must pay some more money, because that is now going to take care of. So that is why alternative processes are so difficult to fly. When I mean flying, I mean, like I've said in the past, I've said many times, I said, if I would be covered by medical aid, I promise you, because the majority of people who cannot afford to buy medication, they want medication, but they cannot afford, they don't have the money. And some of them have got the medical aid. And if therefore the medical aid would cover my treatment program, I'm telling you, I don't know, I would
Sorted.
I would help a lot of people. I really would. So that's the problem with alternative medicine, and that is what make it difficult for alternative practitioners to do much more than they are doing, because it boils down to money. Those people must pay for this, and they don't have the money to cover all this. So you fix this, you move to the next one, whereas with conventional, the medical aid is there. It's going to cover,
Cover, yeah.
So, yeah. So that is the situation, therefore. But people who have got respiratory, if you're struggling with conception, infertility, you cannot conceive, they tell you you're ovulating normally, sperm count of the husband is good, but you guys are not conceiving. You may very well find you have got cystic fibrosis, because even though the sperm count would be fine, but if it cannot flow through because the mucus is thick, that has got nothing to do with the mobility of the sperm. It has got everything with the passage through which it must flow. So, and they may not be able to detect that. But with me, I'll be able to detect that. So if you've got problems of infertility, but both of you must come. It may very well be cystic fibrosis. If you've got problems of poor weight, you eat, but you just are as tiny as someone who doesn't eat, you may very well be sitting with pancreatic cystic fibrosis. Or you've got respiratory problems, you're on chronic medication for, then you must come to me and I'll be able to advise you what is the situation with you, and then we can map the way forward together. That's where we end our show today. Thank you for watching, and goodbye.
Thank you for tuning in, viewers, and hope to see you next time again. Thank you.